We are looking at our suicide data, as I've said before, to hopefully be able to make at least the first 6 months of the year public. We don't have a firm date on that, but what I can say is that the investigations do take a little bit of time, and so data is preliminary, but so far we have not seen an increase in the number of suicides when compared with previous years. What we know is that this pandemic has come with multiple challenges for people's mental health. Certainly, imposing restrictions on people's activities does bring additional challenges, but so does the impacts of some of the economic challenges that Alberta is facing right now, and some of those are obviously related to challenges with the public health measures, but there are additionally other economic impacts that are independent of the measures that we may or may not take within the province. What's really critical is that, as I've said before, any of the restrictions that we put in place, any of the measures that we put in place are targeted at where they're needed most, that we're focusing on keeping our health system operational, keeping the spread of COVID-19 manageable. And with respect to tracking the impacts on, for example, mental health in general and mental health in youth specifically, I have spoken previously about the Health Quality Council of Alberta, who did a survey in spring of this year, which did indicate that we were seeing significant increases in people who were reporting mental health challenges, increases in anxiety and depression. I believe that this is a complex issue, that it is not just about imposition of public health measures or not, but of course it's multifactorial, and there are many things that contribute to people's mental well-being. And there is always help out there. The Alberta Health Services website, Help in Tough Times, is really a good resource for anyone who's looking for information. There's a 24-hour help number that's available for not just those who may be struggling themselves, but those who are family members or friends of someone who's struggling. I don't have any specific figures on youth in particular, but again, would say that the balance of all of the factors around health is exactly why we're taking the approach we're taking, which is to say we need to support Albertans' whole health, which means managing the spread of COVID and making sure that the restrictions don't go farther than they need to make sure that we're protecting Albertans' overall health.